Hello, my name is Joshua Diaz, and today I'll be discussing my ethics paper topic. The topic I chose was futile CPR and pre-hospital DNRs. I'll begin by first defining those acronyms. DNR stands for Do Not Resuscitate, and CPR stands for Cardiopulmonary Resuscitation. I'll elaborate my topic by giving two scenarios that explains this topic better. The first scenario has to do with a pre-hospital DNR. Should a paramedic come to a scene, and the patient is in cardiac arrest and has no heart rate and breathing, without the presence of a pre-existing DNR paper in hand to show the paramedic must begin these resuscitative efforts. If the patient's family informs the paramedic that the patient is a DNR and does not wish to be resuscitated, he must first contact his medical control and receive permission to cease these efforts before they can stop. When it comes to futile CPR, in a similar situation, if a paramedic comes upon a victim of cardiac arrest and the patient's family is there and wishes the resuscitative efforts to begin, but the paramedic feels that the patient has been down too long and CPR would be a futile effort to perform, the action would be wasted. This would be futile CPR. The ethical issues for pre-hospital DNRs mostly have to do with autonomy. Well, both scenarios have to do with respecting the patient's wishes. When it comes to pre-hospital DNRs, the autonomy of the patient who, when they were able to, wanted to be a DNR, but due to the lack of paperwork, the paramedic is forced to start resuscitative efforts and then receive permission to cease them, whereas in the futile CPR scenario, the family who is representing the patient wishes CPR to begin even though you think it may be futile. The EMS Code of Ethics applies to these scenarios by two main points: to conserve life and alleviate suffering, and clinical excellence in patient care. Obviously, CPR is an attempt to preserve life, but alleviate suffering is the part that I choose to hone in on. When it comes to DNRs, you are alleviating the suffering of the patient by granting his wishes to not be resuscitated, and you're alleviating the suffering of his family by not resuscitating him when he verbally asked not to. There seems to be a gap where, in a hospital setting, the verbal wishes of the family would be followed immediately, whereas in the pre-hospital setting, the verbal wishes of the family have to be run through medical control before the paramedic can cease resuscitative efforts. And critical excellence in patient care. I feel this applies to futile CPR in the sense that if you feel that the CPR is futile but the family is asking, the family becomes the patient you are treating. Their emotional stability, them seeing you put forth the full effort to resuscitate the victim, even though you know it may be futile, it helps with the emotional distress that the patient's family may feel. The reason I chose this topic is that I plan to become a paramedic. I wanted to learn about these very real possibilities and scenarios I may face in the real world. I've learned about these ethical dilemmas that I might face, and I look forward to being able to discuss these as I've educated myself, and in the future, I'll be able to have productive discussions about these topics, as no conclusions of solid procedures has been reached about either of these topics yet. I want to thank you for your time listening, and I look forward to seeing your comments and your posts. Have a good night.